June 8th is considered as the World Brain Tumor Awareness Day. Brain tumors are quite common and can occur at any age group. When the brain tumor occurs, the most common symptom is the headache. But it doesn't mean that every headache means it's brain tumor. So there are many reasons for the headaches, including the social problems called tension headaches, which is the most common in the society. After that, we have migraines, we have variety of other headaches. But when do we suspect a brain tumor is whenever the headache is progressively increasing day by day, usually occurs early in the morning, associated with vomiting, and vomiting usually relieves the headache, if not totally, partially. And the headache is usually not responding to the routine medications, including the painkillers. And when the headache is associated with either epilepsy or vision problem or any neurological weakness or speech disturbance, we suspect the brain tumor. Now, the most characteristic headache is the early morning headache, which is gradually increasing, not responding to the treatment. We should investigate. We should not neglect that. Now, brain tumors are many varieties. They can be called as primary brain tumors that arise from the brain itself. The secondary brain tumors are some other tumors that come from the body into the brain. We call also as metastasis. Now, the primary brain tumors, they can arise from the skull bones. They can arise from the coverings of the brain. They can also arise from the blood vessels of the brain. They can also arise from the brain substance itself. Now, depending upon the nature of the tumor, they can be benign. That means they grow very slowly and cause all these symptoms, and when we remove them, it's more or less a cure. Some of them are malignant. They have a tendency to keep growing, particularly the glioblastomas, the malignant brain tumors, which may require, apart from removal of the tumor, the chemotherapy as well as the radiotherapy. So today's technology gives us tremendous advantage to identify the tumor with an MRI completely. I also identify the surrounding structures which are important for the individual, and we will be able to remove the tumor totally. So that's the one which will give us the maximum result. To achieve that goal, we have several technologies like neuronavigation, intraoperative imaging, and intraoperative monitoring techniques. And most important thing is the awake craniotomy. Now, whenever the tumor is situated in a very important areas, for example, concerning with the speech or the hand movement, we do the surgery when the person is awake, and the patient will be talking to me, and though I know exactly where we are in the brain and how much we are removing and what are the other areas we are touching, so that we will make sure that there is no damage to the surrounding brain, but at the same time we remove the tumor as much as possible sometimes, so that gives the best possible cure. Now, once we do that, depending upon the nature of the tumor, as we get in the histopathology report, we will have to plan the subsequent treatments.